So it's a thrilling moment to meet you again, this marvelous audience, and thanks for the invitation by MOCAT the next year, inshallah, with you. So this is a case presentation, a case report about a young doctor. He presented asking for some sort of refractive surgery. It's quite well. This is the normal non-notifiable topography and aberrometry. He underwent uneventful refractive surgery, and he presented next day with a smile on his face and metropia. And he's planned for 3 days follow-up, routine follow-up. But he's after 2 days presented, okay, I'm complaining from excessive redness in one eye, the right eye. And I noticed this picture. Actually, this whitish dots within the exactly. Well, I thought this is bad news. The things that jump in your brain are first of all the infection. First of all, and these whitish dots remind me of the bad scenarios that I faced in my life. And these bad scenarios, including all the sorts of infections that you can face, the PRK, post-refractive surgery infections, and my colleagues are smiling because they saw these cases before. And on the other hand, I had the sterile infiltrates. Sterile infiltrates on the right side. It looks okay after refractive surgery. You can see the picture on the right side top. The contact lens is still on, but these whitish dots are here. The whitish dots here after PRK, for example, with this ring notifies or alarm you that some sort of error is going on and you have to suspect some sort of infection. Fortunately, this was a sterile infiltrate after PRK, but honestly, I did not face these cases after the small surgery, the lenticular extraction. So, in case of lenticular extraction, this is an emergency. I have to choose one of the ways. If it is infection, this needs intensified antibiotics in the forms, if it's early, 4th generation or fortified antibiotics. If it is late, no, can use amikacin. And sometimes need some pocket lavage with antibiotics or some sort of disinfectants and scraping, sometimes culturing, and even reach to the stage of cross-linking as a prophylaxis against the corneal melting. But we have a peculiar case in Reinstein, recognized this peculiar case of what's called sterile multifocal inflammatory keratitis, SMIC, in which we have excessive sort of lamellar keratitis, and this lamellar keratitis predisposed to whitish spots, in which the treatment is to intensify the steroids and sometimes pocket lavage. So I have two ways to choose. One of them is to use the steroids, and the other is to intensify the antibiotics, which exactly the reverse of each other. On the review of literature, we can see that the infection is quite rare. Quite rare. But the sterile keratitis may be up to 1 case per about 700 cases. Sweeney criteria, I chose, according to that, the pain was that minimal, the location and the discharge, so I chose this is an sterile inflammation. Sterile infiltration, in which the moment of choice, because this was I have to decide at that time, and the next day the whitish spots spread. I intensified the steroids, but now the whitish spots are increasing. Unfortunately, the bad news, he is a doctor. He is the son of the dean of our college. He is a brother for 2 other doctors, and he is a son of a gynecologist. So,
هتولي جيت
so But with intensifying steroids, the whitish spots are increasing actually. It increased, and at that moment, I called for help. I called two of the audience, thank you, of course. What to do? I am facing infection. Am I facing infection? It is a moment of challenge. Fortunately, after 24 hours, if after intensifying the antibiotics, the whitish spots are decreasing. It is decreasing. You can see the change in the subconjunctival hemorrhage. Now, after 2 weeks, it is less and less, and the scar which appeared, infiltrate, appeared very intense. Now it's decreasing. The topography, which is with irregular stigmatism, now is flattening. Fortunately, the case is decreasing from such intense inflammatory and high suspicion of infection and disastrous infection, which ended in mild scars. So the story of the scar face, the battle ended with a scar on your face, but you have more battles to face. The take-home message, never ever do a procedure for the son of your dean. Thank you.